Welcome my friends, I hope that you are all good, but it is necessary to be aware about your child health, and in this video, we will discuss about cough medication in kids. Parents of young children may feel like their kids are always sick, and they probably aren't that far off. A child can deal with as many as 6 to 8 colds per year, and most children will have 8 to 10 colds before they turn 2 years old. Cold symptoms can include a runny nose, sneezing, a low-grade fever, and a cough. While a cough resulting from a cold may be frustrating to both child and parent, treating that cough isn't always as simple as giving them medication. While cough medicine for kids does exist, some experts don't recommend it. Additionally, the Federal Drug Administration, FDA, does not recommend over-the-counter cough and cold medications for children under 2, stating that they can cause serious and potentially life-threatening side effects. Here's a look at what parents should know about cough medicine before considering giving it to their kids. What is kids' cough medicine? Over-the-counter kids' cough medicine is meant to help alleviate upper respiratory infection symptoms such as cough, congestion, and mucus. The FDA does not recommend OTC cough and cold medications for children because they can cause serious or potentially life-threatening side effects. You will see over-the-counter options, as well as homeopathic options on the market. When should I give my child cough medicine? Experts don't typically recommend giving cough medicine to kids. According to the FDA, over-the-counter cough medications are unsafe for children under 2 years old. According to the American Academy of Pediatrics, AAP, cold and cough medicines should not be prescribed, recommended, or used for colds in young children. Additionally, Nationwide Children's Hospital advises that cold and cough medicine should not be given to any child under 4 years old. They also note that you should ask your doctor before giving the medication to a child between the ages of 4 and 6, and that children over 7 can have kids' cough medicine as long as they are given the correct dosage. Typically, promises made by the manufacturers of cough medicines for kids are more about marketing than medicine, says Arthur Lavin, MD, a practicing physician at Akron Children's Hospital in Akron, Ohio, and he emphasizes that parents shouldn't give cough medicine to their kids. While kids' cough medicine may relieve symptoms of a cold, they do not actually cure the illness, explains Drive Lavin. Bottom line, you should always speak to your pediatrician or a qualified physician before giving cough medicine to a child, regardless of their age.